For the past few days, a group of highly trained medical professionals have been making their voices heard outside the Eastern Cape Premier's office. Unemployed doctors and dentists are demanding to be hired, citing a desperate shortage of healthcare workers across the province. Last year, the South African Medical Association and other unions protested against the unemployment of doctors. How big is this issue of unemployed doctors, not only in the Eastern Cape, but in South Africa? Let's now have that conversation with the Minister of Health, Dr Aaron Motsoaledi. Minister, very good morning to you. Thank you so much for making time for us. What's your reflection around what's happening here with the unemployed doctors?
Well, Aldrin, let's talk about unemployment generally. It is not nice, and I don't think anybody in the country, inside or outside government, enjoys the issue of people not being employed. You are aware the concept of unemployed graduates started long ago. It's not only doctors. Yes, there is a shortage of doctors in 90% of the world. We know that very well. But to hire them also, you need resources. Now, in our country, I'm sure you are aware, even in September, the Minister of Finance mentioned it. We, even in February, we have got very serious austerity measures, very crippling budget cuts that affect not only our capacity to hire doctors, but to perform quite a large number of functions. So yes, we do agree with the grievances of doctors, but in the final analysis, you cannot give a job for which you don't have the means to pay such people, and that's exactly the situation in which we are.
Yeah, speaking about what Treasury said last year, there was a promise that was made by your successor, Dr. Joe Phaahla, while he was still Minister of Health. This is what he said: our national team is working with the National Treasury to thresh out the details and working with provincial health departments to speed up the process so that by April the 1st, all those who will not be already in post can start, meaning that money will be made available through Treasury. And he says that I'm confident that with this certainty, provinces will be able to start giving appointment letters even before April the 1st, 2024. So what happened to that commitment?
Well, we are discussing with Treasury almost every month about our needs in health because of austerity measures. But as far as I know, I don't know under what conditions Dr. Phaahla was making that statement. As far as I know, at that time, because I was also in cabinet still, the Treasury was discussing about the issue of internship. Because Aldrin, please give me some little bit of time to explain this, because I've had all lots of statements. Yes, in medicine, you study for 6 years. When you complete, you can't do anything. You can't work. You can't go into private practice. You can't open your practice. You can't do anything unless you do internship, which is for 2 years. It is statutory, means whether the government likes it or not, the Treasury will have to stop something somewhere to hire an intern because it's statutory. And now that's what I remember at that time. There were more than 800 doctors or interns which were not placed, and they were discussing with Treasury to place them. After you finish internship, you go and do community service, which is also statutory. You are forced by law. And so the state is forced to hire you, whether it likes it or not. After that, you are a free person. You are a full-fledged doctor. You can go anywhere. If the state advertises post, you can apply. If the post is in a private sector, you can apply. If you want to open your own private practice, you can do so. If you want to go and work elsewhere, you can do anything. Now I hear words like absorption. After community service, there's nothing like absorption. You apply for a job like any other job seeker, like any other graduate who is employed somewhere. I personally am a doctor. I would like people, and I'm a minister too, I would like people to get employed, but I don't want to give you an impression that there's a special deal for some people because they are doctors. We also have unemployed nurses, unemployed social workers, all of them, unfortunately, because of austerity measures and budgetary constraints.
So does this mean then when Dr. Joe Phaahla last year during the president's SONA debate said that the money has been found to hire the doctors, that wasn't true?
No. I say I remember. I was not there. I can't vouch for that. I say I remember the issue here being about interns because it's statutory. Treasury is forced to stop something somewhere within the state to make sure that the government meets its statutory obligations. I'm talking about that. Any other job in the state, whether of a doctor or a nurse or a teacher, there ought to be a budget and such jobs get advertised. There is nothing called you are absorbing. The only people who get absorbed are those who are fresh from university, doing internship, and fresh from internship doing community service. After that, you are a job seeker like any other. That's why at the moment, some few jobs have been advertised. Like in Gauteng, they've advertised 57 jobs, in Limpopo 54, in Mpumalanga 26, in Northwest 25, in Northern Cape 60, in Western Cape 73. All of them, the closing date was in December, which means they are still going to appoint such doctors. But these are advertised jobs, and they can't advertise more than this if they don't have money to pay. You can't hire people which you are not able to pay. Any employer anywhere in the world, public or private, will only hire people if you have got money to pay them for that employment.
Yeah, and due to these austerity measures, unfortunately, the department can't employ these people, even though there is a critical shortage. What is our current doctor-to-patient ratio in the country?
There's a critical shortage of doctors anywhere in the world, I must say, Aldrin. Maybe except in Cuba, because it's known to be the only country that exports doctors. You know, it's their foreign export. All other countries recruit, and they've got a shortage, but the poorer ones, it's a double whammy. They've got a shortage, but they also have a problem of small economies like ourselves, so that we have got a shortage of doctors, but you also cannot hire them. The richer countries only suffer a shortage of doctors, and they recruit them. We have even discussed this matter in the World Health Assembly, where all ministers of health in the world meet in Geneva every May. One of the topics was this issue, because very small countries complain about losing doctors to rich ones. You know, for instance, in the Middle East, they don't train doctors, they don't train nurses. They just get them from African countries and pay them a lot of money because of their oil reserves, and you can't compete with them. So it's a little bit of a more complex issue of having a shortage, but also not resources to deal with that shortage.
Yeah, but what is our doctor-to-patient ratio, and how does it compare in terms of the WHO recommendation of 1 to 1,000 patients?
Unfortunately, I don't have the figure right here with me. We don't even look at it because we know we are very, very far from reaching it. I've already informed you there are not many doctors who reach that ratio. It's quite high. Maybe only richer doctors are nearer to it. And I'm insisting that as far as I know, the only country that has really completely reached that ratio and even exporting doctors elsewhere is Cuba. All the others who are at various levels depending on the strength of your economy. But unfortunately, I don't have the hard figures here with me.
Yeah. Then what's the plan going forward? Because interview that my colleague Naledi had yesterday with the spokesperson for the unemployed doctors in the Eastern Cape, Dr. Ngai, she mentioned the fact that what this has led to, this critical shortage, is a delay in patient care, but it also leads to another problem, which could be the medical legal claims that then come against the Department of Health. And we know how the provinces themselves have been crumbling when it comes to their budgets around the medical legal claims that have also been escalating.
Well, fortunately, in 2015, Aldrin, when medical legal cases became worse, we had a conference to try and deal with the issue. It's not only the shortage of doctors, it's several factors that lead to medical legal claims, and we've put measures to try and deal with those. But you know that one of the factors is that quite a number of claims were found to be fraudulent. That's why we brought SIU in. So it is true that it does affect that, but it's not only about employment. It's about many other factors, including infrastructure, equipment, skills, including the management, how the management of that hospital handles things. So it's a myriad of factors other than just the employment.
Yeah, and when we have conversations like these, then people look at them and then say, and here you have the government that wants to push the national health insurance. What's your response to that particular argument, that here you have a... Okay, you can go ahead, Minister.
I was expecting that question. I would have been surprised if you don't ask it, because many people ask it because they don't understand. Although national health insurance is not a part of a vintage healthcare system in which you enter when you have got all the doctors you need, all the equipment, all the facilities, and everything that is needed in a healthcare. That's not what universal health cover or NHI means. NHI is a healthcare financing system, partly to resolve the very same issue they are complaining about. Because, for instance, you are aware that according to the World Health Organization, a country must spend at least 5% of its GDP on health. Then citizens are likely to get very good health services if you spend that 5%. In South Africa, we've already far exceeded it. We are at 8.5%, which is not different from European countries at an average of 9%. So what is our problem? People mention all the other problems like corruption, mismanagement, etc., which I can't deny they are there. But the core problem is the manner in which the money in South Africa is distributed. 51% of that money, of that 8.5% of GDP, go to support only 14% of the population. And a whooping 86% of the population remains on the remaining 49%. That is the issue of gross inequity, which NHI is there to solve. And we are not the only country in the world that came with the concept of NHI. It is called universal health coverage, discussed by the World Health Organization, adopted at the United Nations. I don't remember a single country that said they want to opt out or never supported it. And the reason, the basic reason, is equity in health. How do you spend the money that is in health? So in short, we are saying money is there in South Africa, but it is completely unevenly distributed in favor of only 14% of the population who are well-to-do. And when we implement NHI, that is our target. That's the issue we want to solve, not the other things that people are mentioning.
Yeah, but would NHI be able to deal with this issue of unemployed doctors, though, in terms of, we speak about doctor-to-patient ratio?
If you distribute the money equitably, yes. You won't 100% deal with it. As I said, I repeat it, I don't know any country that has been able to do that yet, even though some are better. But once you have equitable distribution of resources, you are in a better position than we are in now, where at the moment all the money goes to support 14% of the population, leaving 86% in the large. That's what NHI is here to solve. Now I hear people saying, no, solve those problems before you bring NHI, meaning if we are able to solve those problems without NHI, then we don't need NHI. The reason that the world came up with it, it was looked at as the only solution to unequitable distribution of health resources around the world, between countries and even among countries, inside countries themselves, which is what South Africa is